This conference will now be recorded.
Good afternoon. This is Don Moss, and I will give you a presentation on hypnosis, mind-body perspectives, and consciousness. Greetings from Saybrook University in Pasadena, California. I regret not being present in Budapest for this exciting New Generations Conference. I'm happy to provide you my remarks by recording. Take-home messages for my talk. This presentation advocates psychophysiology as a framework both for research and practice in hypnosis and in hypnotically assisted psychotherapy. Neurophysiological monitoring can provide valuable perspectives in research on the neural and physiological correlates of hypnosis. Mind-body practices in clinical settings, such as meditative breathing, can enhance the patient's openness and receptivity in therapy. Physiological monitoring in clinical sessions can provide a window into the soul, alerting the patient and the psychotherapist to emotional and distress reactions which are not yet conscious. Physiological monitoring can also serve in a kind of trance ratification, giving credibility to hypnotic processes. So, what is scientific psychophysiology? Well, in science, psychophysiology can be conceptualized as an extension of anatomy and physiology. We utilize the tools of physiological monitoring to better understand cognition, emotion, and behavior. Applied psychophysiology takes the lessons of scientific psychophysiology and applies them in practice settings. So applied psychophysiologists are professionals who conduct physiological assessments and interventions in applied settings and clinic settings, treating patients with medical and mental health disorders, and also assisting healthy people in fields such as sports and the performing arts to optimize their performance. Common psychophysiological interventions include biofeedback, relaxation training, brainwave training, and many others. Many of these interventions integrate easily with clinical hypnosis and augment the effects of clinical hypnosis. I'm going to take you back to the beginnings of applied psychophysiology and Elmer Green. Elmer was the director of the Voluntary Controls Clinic at the Menninger Foundation, and in 1970 he formulated the psychophysiological principle. Every change in the physiological state is accompanied by an appropriate change in the mental and emotional state. Conversely, every change in the mental and emotional state is accompanied by an appropriate change in the physiological state. So the body acts on the mind acts on the body. Recognizing this mind-body connection is a beneficial part of therapeutic change. This is not a new insight. We can look back to the ancient Chinese, the time of the Qing dynasty, and we find this formulation. The tranquility of the mind regulates the breathing naturally, and in turn, regulated breathing brings on concentration of the mind naturally. So the mind acts on the breathing acts on the mind. In clinical settings, we can introduce mind-body practices such as meditative mindful breathing and enhance the therapeutic receptivity of the patient. I begin most of my psychotherapy and hypnotherapy sessions by breathing gently, slowly, quietly with the patient, increasing the patient's awareness and expression of emotion, as well as my own. This also reduces inhibitions which block therapeutic progress or therapeutic awareness. In addition, if a patient does block in therapy or struggles with emotional pain, we can return to a moment of mindful breathing and reduce the intensity of distress and enable acceptance. We can also introduce electronic monitoring of physiology in clinical sessions to enhance the patient's recognition of the mind-body connection. We can use biofeedback instruments to detect subtle physiological changes not evident to the observer without instrumentation, providing a signal to the therapist and the patient alike of emotionally significant internal responses. The display of the biological signal often serves to reduce therapeutic tensions around resistance. Patients typically will perceive the biological signal as objective and respond by accepting the message of the signal more easily than they accept interpretations initiated by a therapist. Now, what kind of signals am I talking about? A couple of examples. Electrodermal biofeedback, also called the galvanic skin response. We apply a tiny microcurrent of electricity to the skin. We measure electrical resistance, electrical conductivity, especially changes in either one of these. These come about through increased or decreased sweat gland activity accompanying our emotions. Increased sweat in the skin increases conductivity for electricity. The electrodermal response gives us an index for sympathetic nervous activity. Worry, anxiety, or cognitive stress will increase sympathetic activity, increasing eccrine sweat gland activity, and increasing the conductance of electricity. So the electrodermal response is a rapid warning system for emotional responses highly relevant for psychotherapy and hypnotherapy. We can look to Carl Gustav Jung as the first modern psychologist to use electrodermal instruments in psychotherapy. He published a book titled Studies in Word Association in 1906. He measured the psychological significance of words by their electrodermal response. This is a live moment from a therapy session, and the patient, as seen by the green line at the top, the green line graph showing electrodermal response. The patient is relatively relaxed and appears to be relaxing further. The electrodermal response is going down, 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 and suddenly there's a dawning awareness of negative emotion about the workplace, and we see an increase in that line graph of electrodermal activity. Two more signals, respiration and heart rate variability. You all know about breathing, respiration, and the fact that breathing, slow, relaxed breathing can calm a person. And anxiety is often accompanied by hyperventilation or rapid breathing. Heart rate variability refers to the change in the time intervals between adjacent heartbeats. You see the EKG, the electrocardiogram segment on the bottom left, and you see the R waves. The segments in between R waves are called the interbeat interval, the time period between R waves, and those segments should be constantly changing. The healthy heart is not like a metronome. It does not beat steadily. Rather, healthy organisms show organized change in their heart rate, reflecting internal regulatory loops, causing increases and decreases in heart rate. When traumatic memories, interpersonal conflicts, or negative emotions impact on the person, we see changes in respiration and changes in heart rate. And patients and therapists can learn to understand and monitor the cardiorespiratory display on the computer screen during therapy sessions. There are two displays on the right. The one at the top shows a moment of relative calm in a therapy session. If you look at the very top of that display, you see smooth hills and valleys across the screen, red and blue. The blue is respiration, the red heart rate. Each time I inhale, there's the blue line goes up. Every time I exhale, the blue line goes down. Heart rate in red tends to follow breathing, so that as I inhale, we begin to see an increase in heart rate. As I exhale, there's a decrease in heart rate. And the pattern is relatively smooth across the screen. If you look at the lower part of that same display, you see a large aqua bar showing that almost all the variation in heart rate is focused around a time cycle of about 6 cycles per minute. The person is breathing about 6 breaths a minute. We have about 6 heart rate changes per minute. Almost all of the heart rate variability is organized by that single process. Down at the bottom, the same person, you suddenly see the red line become more disorganized, and later on the same display, you begin to see the blue line also becoming disorganized. So first heart rate becomes more erratic, and then breathing becomes more irregular. And if you look at the bottom of that second display, you see that large aqua bar is still there, but it's decreasing, and there's more activity over on the left in navy blue. That's an increase of sympathetic activity related to negative emotion. So here's a live moment in therapy where we see that same thing happening. We see a relatively relaxed patient with relatively smooth hills and valleys of heart rate and respiration at the top on the line graph. And just about now, the heart rate is beginning to disorganize, and breathing is becoming a little more erratic. And if you look at the spectral display at the bottom, you see the large aqua bar in the middle is decreasing, and we're getting more and more activity over on the left, indicating negative emotion. And now the patient seems to be trying to recover, trying to smooth the breathing again, trying to regain some emotional control. And we start to see a restoration of that large aqua bar, reflecting activity related with slow breathing. Okay, now a couple quick case examples and my time will be up. The first case example, gaining mind-body awareness through physiological monitoring. Larry presented himself as a happy man content with marriage and family. To the therapist, he appeared to be an angry, resentful man, but he resisted any discussion contrary to his rigid self-concept. His psychotherapist monitored electrodermal activity and heart rate variability during therapy sessions. His electrodermal response elevated noticeably, and the very low frequency range activity of heart rate variability spiked up in activity, blue spiking of activity at the left of the display, each time the topic of his marriage and wife was mentioned. The physiology was more convincing for him than the therapist's perceptions. Larry began to get receptive to this objective witness to his unrecognized feelings and made comments, for example, that he didn't realize it was strong enough to affect his body, but he was aware of some growing frustration with his spouse. Second example, this one actually will utilize the EEG, brainwave activity. Nora, a 43-year-old emergency medical technician and firefighter, presented with repeated trauma in the line of duty and classic symptoms of PTSD, including nightmares, daytime flashbacks, baseline vigilance, and a heightened startle response, as well as a loss of emotional spontaneity and social withdrawal. She was discouraged by setbacks in her life and in her therapy, and quit psychotherapy in discouragement several times. We monitored her with EEG during many of the hypnotherapy sessions, and in one session she showed a dramatic elevation in cortical activity centered at 28 Hertz. We interpreted this EEG feature as a ruminative reliving of a trauma scene. During hypnotic induction, the spectral display of the EEG flattened across the entire spectrum, completely erasing that 28 Hertz elevation. She was shocked and said, "I knew I felt better, but I didn't think hypnosis really did anything." Seeing the change in her brain convinced her that the hypnotically assisted psychotherapy might have lasting impact and value. Thank you to your attention to my message that psychophysiology can be a useful adjunct in the science, the research on hypnosis, but also in therapy sessions. Thank you for your time and attention.